So what I'm going to do is to illustrate what Professor Landfester already said in the beginning of the conference, of the afternoon program, and illustrate the working model of the HSG Hub Sao Paulo by the help of the case of Dr.Consulta. And thank you very much as well, Thomas, for joining us in Switzerland. It was a pleasure to have you. So my name is Johannes Boch, and I'm the current coordinator of the impact investing activities of the HSG Hub in Sao Paulo. There are some of my forefathers as well in the audience. So if you want more information, I'm sure they will provide it to you as well. So by the means of Dr.Consulta, I would like to illustrate our working model and how we do research, academic consultancy, like we say, with the students of the University of St.Gallen that go to Sao Paulo or Brazil. So we have had a structuring process in 2014 where we structured our activities in the area of impact investing into 3 pillars. That is the generation of knowledge, the transmission of knowledge, and the diffusion of knowledge under the umbrella of impact investing Latin America. That consists of several stakeholders, which are foremost universities or public institutes, so independent entities. And we try to contribute as a university to the growth and to the mainstreaming of the impact investing area in Brazil and in Latin America. So I'm going to illustrate how we are trying to do that with Dr.Consulta. As Thomas already mentioned, it's a Swiss-Liechtenstein entity that is the main investor of Dr.Consulta. And in the beginning of 2014, we as the University of St.Gallen got approached by this investor in order to conduct a study with Dr.Consulta and to look into several aspects of the business they recently invested in, and it was the first portfolio company they had in Brazil. So the investor had a few demands what the research should look like, and Dr.Consulta as well. So the investor was looking at the evaluation of the social impact and to gain more visibility for the project. And Dr.Consulta, on the other hand, was looking how to attract more customers, how to make the customer experience more adapted, and also to look inside what is the social impact of the business. So we as the university and as an academic entity, we had to combine those demands from the field and to combine them with the research method that was given by the university. And so we were looking at the university, what kind of methods are prominent at the university, and we found the assessment of public value creation, which is represented by Timo Meinhardt from the HSG. And by the means of this method, we tried to combine those two worlds to find the information needed for the investor and the project. So we had the first phase that was the assessment of the data with Dr.Consulta in the slum of Sao Paulo, investigating several entities and stakeholders. And afterwards, we tried to integrate those findings into the strategy and give hints how Dr.Consulta could use this data to do proper marketing for the strategy or for the human resources. So what we did with the public value assessment, where several stakeholders are investigated and interviewed by hands of a culturally adaptive and sensitive questionnaire. We tried to assess all of these different perceptions, which were the customers or clients of Dr.Consulta in the favela, the interperception of the management team and collaborators and staff, but also external experts' perception like the investor or entities of the favela. And we tried to combine that to get the perception of Dr.Consulta in the public. So all these information we had that was very positive for Dr.Consulta as well. We had some critics as well that we tried to combine with the entrepreneurial aspects that are taught at the university as well, and to identify the challenges and possible challenges of the future of Dr.Consulta as a venture. So we found the quite, I think, prominent growth challenges of a venture. That is the growth, especially finding location in Sao Paulo is quite important to have access, that the people have access and easily access to the clinics, especially as well the human resources, the medical ethics, which is also a part of the impact investing, how would you say, perspective of Dr.Consulta. The IT system and processes which have to grow, like Thomas already mentioned, and the question was also about the relation with the public sector. So how could we fit that inside the model of the University of St.Gallen? That is also, the logo is prominent on our banner as well. So we completed the generation, transmission and diffusion part with the project in order to help the project to gain visibility and to gain useful information that can be imminently useful for the growth of the company. So we did the public value assessment that I mentioned, assessed several information, and in order also to connect the relations, the different perspectives of investor, project and client, to bring those different worlds together again. We wrote a case study that was also already used as in the university, as well as for executive education in Sao Paulo. And we have had several conference presentations, an article with the World Economic Forum, and our own distribution channels. To mention this kind of working model, we aim at reproducing this working model with all the projects we are collaborating, which is not only was not only Dr.Consulta, but also we have had several projects in Brazil, but also the connection Brazil and Peru. And we always have several entities that are present in the projects. For example, the Womanity Foundation that was talking in the morning, or Fundação Telefônica. And by this approach and our striving to create and diffuse the knowledge on impact investing, we think that this is our responsibility as well as a university to help those projects to grow and to gain visibility, and our part as university to support the ecosystem to mainstream. So thank you very much. The overview